Good afternoon, dear friends and colleagues. Basically, I'm the oculoplastic specialist, and I think most of our colleagues today is a cataract surgeon and glaucoma surgeon. But I think in my practice, I do some cataract. But in my thought, to treat the dry eye and comparing to the cataract surgery, dry eye is much more difficult. Because the cataract surgery, we have done about 15-30 minutes and it's all done. But the cataract, you have to respond for the rest of the patient life, and it's much more difficult, especially the patient that have the difficult dry eye disease. So the dry eye and is one of the most common overlooked second after the normal tension glaucoma. And it's very important to preventing the chronic inflammation and meibomian gland disease. So this talk gonna focus about the diagnosis and important and the advanced treatment. In my practice, I practice in the private practice and 100% in the hospital, 100% in my private practice. And I consider the treatment for the dry eye like an anti-aging. I always tell the patient that this is an anti-aging treatment. And for how important, if we do not treat when the patient was young, when the 10 year, 20 year, 30, 40 year later, they have developed the severe dry eye or ocular surface disease. Chronic chalazion hodulum may happen. Sometimes I found 30 hodulum in one case, and lately cicatricial entropia will at the result of the severe meibomian gland dysfunction. But nowadays, the difficulty is to create the awareness of the ophthalmologist and the patient. It's very difficult if you have to take care of about 30 patients a day. You have to talk about 20 times for the dry eye, 20 times for the meibomian gland dysfunction. So that's our tough job, and that's really tired in our practice. And focus on the treatment. There'll be the short-term and the long-term treatment. I considering if we have the dry eye or meibomian gland dysfunction, we try to make the eyelid that's so red and turn to normal as much as possible. That's a really challenging job. And look in the picture, in this one, if we don't treat them, it can direct from the healthy to be moderate and severe meibomian gland dysfunction. And lately on the lower right bottom picture, they can develop the cicatricial entropia and contraction on the whole eyelid internal structure and the loss of the significant meibomian gland. How to create the awareness? In my practice, I started doing this like 10 years ago. And I think it's very important to notice to the patient if you have the Demodex or bacteria in your eyelashes. In the first consultation, I think it's worth enough for us to notice about the cause of the dry eye, bacteria blepharitis, Demodex blepharitis. I think it's worth enough to buy the digital camera and slide, digital microscopic slide, and show them how many Demodex you have, how many cylindrical dandruff you have, because the Demodex is so stubborn. And they're living inside, they lay the egg 30 eggs a day, and they're living 14 to 20 births 3 weeks and then die. If we do nothing, they die, and their body gonna be melt and gonna be like a zombie. And they lay the egg, and their baby eat their mother and father body. So they have no internal digestive system, so they recover the undigested material, and they be the lipase and abnormal enzyme and destroy the surrounding structure. That's why our eyelid gland have been destroyed gradually without notice. Sometimes the meibomian gland have no symptom. Sometimes they have moderate symptom and severe symptom. Let's focus to how to optimize the treatment for the dry eye. We know that the meibomian eyelid hygiene combination with the warm compression, eyelid scrub, and meibum expression. For my job today is focus about the eyelid hygiene. So today I will focus in the Blephex treatment. So cleaning at the Blephex is considering like the big cleaning. And routine cleaning is very important that doctor need to inform the patient to clean super inner row of the eyelashes, because if you clean at home and you clean at the outside, they clean on the outside, but super inner row of the eyelashes still there. If you left about one body of the Demodex, they're gonna lie the egg 30 eggs a day. So to speedy the treatment, the innovation of the treatment like IPL and photobiomodulation and future or the radio frequency, I think they have worth enough to focus. So this is a Blephex. The Blephex, I have used this one for nearly 10 years and it still works well and not broken at all. And I encourage to use a foam with the tea tree oil. And if you have a lot of the Demodex, sometimes if you let your colleague, the nurse do, sometimes the nurse not know enough because the nurse is not sit in the examination room. The nurse didn't know how many body of the Demodex. Sometimes 20 or 30 body for one eyelashes. So I have to sacrifice my time to do for the patient. And the technique that you use the Blephex, I not allow the nurse to use a bare eye. I force the nurse to use a microscope and my colleague to use a microscope for cleaning, because you can invert the eyelashes inside out, and in the opposite side you use any angle of the Blephex to clean. And remember, the super inner low of the eyelash is very important. Even though if you have tried to use the Blephex and you can see like this is so clean, but you think this one for one time of the Blephex gonna clean. I don't think so, because when you bring the patient immediately, you see with the microscope, it look clean by generally. But if you focus to the microscope by maximum focus by the digital slit lamp, this is immediately after the Blephex. And you grab with the good forceps and the lid should be dry, and with the bare hand, with your elbow in the slit lamp table, you can see the body and sometimes you can see the leg and the mouth of the Demodex with the simple digital slit lamp. But if you want to see better, you can put the lashes in the slide and show them in the microscope. In my practice, it's very important to create the awareness of the patient, because of the life cycle of the Demodex is complicated. They can live with that and they can lay the egg and they mate each other and they divide it in the bottom of the hair follicle and they can come up in the nighttime. That's why the patient feel itching at nighttime and they mate each other and they lay the eggs. So the difficulty is to overcome the Demodex. In the old day, they said, oh, just cleaning, not 100%. But in my concept, we need to free from the Demodex or the bacteria. So the first step, we try with the scrub. And like 8 or 10 years ago, the people talk about the oral antiparasite, ivermectin and oral metronidazole. One paper talk about this one, and they can overcome about 72% for the overcome of the Demodex. But it's very difficult for the patient to take the oral ivermectin 6 mg 2 tab and another 7 days for another 2 tab, and metronidazole 3 times a day for 2 weeks, because a lot of side effects. Nowadays, out of 2016, I just try EI. And in 2019, I started to use Luminis, and up 2 years ago, I started to use iLight. So this is a huge improve for the speedy of the treatment outcome. So if you search about the IPL, dry eye, and MGD, recently after 2015 or 17, they have a lot of paper, maybe more than 200 or 300 papers talk about the IPL and how to help it. In the picture, you can see even after 2 times of the IPL, the effect of the IPL from the heat of the light, they can make the unstable of the internal organ by the heat up in the body of the Demodex. They're gonna be die or nearly die. After that, we have to clear up with the very good technique of the lid scrub. And another paper that talk very good. They put the Demodex with the eyelashes and put the real time. After the IPL, immediately they can see that the body of the Demodex getting slow. and no movement at all. That depend on the power setting. But we could not use a very high setting of the IPL because it's too hard. And sometimes the very unusual setting gonna damage your pupil and have the damage about the lens. So with the appropriate setting, gonna help you kill the demodec, but combination with other treatment. In my concept, functional eyelid rejuvenation is very important. And this is a gentleman, 32 years old, with a significant dry eye. He came with a significant meibomian gland loss and eyelid is so red, a lot of telangiectasia and cylindrical dandruff. And you can see that after 4 times of the treatment, the color of the telangiectasia is less of the degree of the redness. And the telangiectasia side of the abnormal blood vessel is shrinked. And the opening is softened. Hyperkeratinization is softened. So when you do the meibum expression, it's going to be easier. But most of the people most of the paper talk about 4 times, 8 times. But sometimes if you have the patient with a dry eye and you use a lot of computer, after 4 times, they're not enough. They still come back and complain, oh, I still have a dry eye. I still feel itching, irritation, not comfortable. So sometimes we do more than 8 times. But in the literature that I have read is about 8 times. And in this one, it's a 70 years old lady with the severe dry eye. We have tried maximal treatment for her. If you can see before the treatment, very bad demodec and bacteria and a very bad telangiectasia and pouting and hyperkeratinization. And you can see started to have the contraction of the posterior lid margin. So after 18 times, they have the improvement. The degree of the redness is reduced. The patient come back to US and do nothing for 9 months. After that, she came back because of really bad symptom. And she came back to me after 18 times of the IPL. And we found that the recurrence of the meibomian can happen. The redness increased. The hyperkeratinization is increased. And meibomian gland have been lost more. So in the picture is 20 times. You can see we have to overcome and suppress the abnormal blood vessel and overcome the obstruction. And in this case, in the real life practice, I have done about 36 times for the IPL without problem. And you can see by the 2 times, the started of the demodec and bacteria gone, and the redness started to reduce it. And after 9 times, they still have the improvement. After 15 times, it's have improvement, but no cure. No normal eyelid margin. We cannot provide the magic improvement or 100% cure by the treatment. So when 21st time is have to step the improvement, but sometimes the recurrent happen. In my practice, I do 8 or 12 times or the IPL. After that, I recommend the patient to do every 3 or 6 months forever for the rest of their life. So meibum expertise is the last option for the treatment. If you take a look on the left upper video, this is the first time of the meibum expression before the IPL. You can see marked turbid meibum like a toothpaste happen. And sometimes in the first time when you do the meibum expression, it's so difficult because the orifice of the meibum gland is not that open. Be patient. Do 2 times, 3 times, 4 times. That start to melt the orifice of the meibomian gland. After you do about 6 times, if you express by yourself, record the video, and you can see and compare to the first before the IPL. The meibum content start to less turbid and coming out easily. Comparing lower and upper, the upper is more difficult because the upper meibomian gland is longer, and most of the patient, the upper is lost more than the lower. The lower that have the dilatation, obstruction, and comparing to expression and the lower is easier. In this patient, he got about 28 times for the IPL and meibum expression. So he still have some dry eye from the work, but she's still happy to come back and get the continuous treatment. So by conclusion, the eyelid hygiene provides functional eyelid rejuvenation and preventing the correct inflammation and microbial biofilm build-up and improvement the meibomian function and tear film stability. And lastly, if we have the good technology, we do encourage to use good technology to apply to our treatment to get the optimal result and preventing the suboptimal result, even though the eyelid surgery, cataract surgery, or glaucoma surgery. Thank you.